I've seen districts utilizing like telehealth providers for their speech and language services, and also less so for occupational therapy, but also for like social emotional, the mental health supports and services. Again, due to staff shortages, that's an option. If it is not an ideal option for your child, by no means should you settle for that. If your child, doesn't do well with that option or that model, definitely push for an in-person model. It may be the case that they don't have an in-house person, so push for the district to contract out with an in-person provider should that be an option. Of course, it depends on where you live and your location, but definitely don't settle for that if it isn't what's best for your child. What you can do to ensure that your child's service needs are being met, request to see the credentials of the service provider. So by law, if you request that, they do have to prove that the individual providing the service meets the minimum criteria. Request service logs. If for any reason you're feeling that in your gut, or you have reason to believe, or that sessions are being missed or certain things aren't occurring, request service logs. That's part of the educational record, and you have the right to see those logs. Of course, if you come to find that services aren't being delivered at the frequency that they should be, or they've been carried out by a professional that doesn't meet the criteria for carrying out that service, that would then be owed to your child in the form of compensatory minutes, compensatory education. I hope that helps. I'm sorry I don't have, a golden answer as far as, a solution. Staff shortages are real. Shortages everywhere are a real concern. I know that isn't an excuse for why your child's educational needs shouldn't be met, but I just do want to kind of stress that it is a reality. It is something I think we're going to be facing for many years to come, in the next 5 or so years for sure. And we all just are going to have to work together as a team to ensure that, each child's needs are being met to the best that they should be, and that the teams are working together, sometimes maybe creatively, to really figure out how to meet all of our kiddos' needs out there.